Today we are going to be talking about acne, but calm down. It is not a regular kind of acne. Okay? You know we have the comedonal acne, right? All this kind of acne where you have to use your salicylic acid, look for lightweight moisturizer, look for niacinamide, look for this kind of acne, that we're about to talk about. You see all those your acne products, they will not work on this kind of acne. Yes, so and that acne is malassezia folliculitis, which is popularly known as fungal acne. It is not really acne per se, but it gives off that acne look when it surfaces on the skin. Now, your regular acne products, you see your salicylic acid, your tretinoin, your niacinamide, your you get it? All these your regular acne products will not work on this one until you introduce a particular ingredient. That is when you start noticing changes. Now, whatever information I'm giving you here, as take it from someone who has experienced fungal acne, right? On my chest region, at the back of my shoulders, just here. This is my shoulder region, I mean my upper arm. Here, here, and then my jaw line. Fungal acne dealt with me, but I was able to clear everything up in max 2 months. Yes. So now let me explain to you how this fungal acne works and what actually triggers it and what you can actually use. Okay, things you can do in order to treat it. Now, how this fungal acne actually forms is mostly it forms mostly on persons with oily skin. So now this malassezia folliculitis, it is a yeast that is naturally on your skin. Oh, it is naturally on your skin. But there are some certain lifestyles you might be living, or there might be some certain things you might take orally that might increase the growth of it on your skin. Now, if you are someone who is so fond of abusing your antibiotics, right? It can cause an overgrowth of this yeast on your skin. If you are someone who is so fond of using very heavy creams on your skin, I mean things like shea butter, just heavy creams on your skin, thick oils on you regularly, right? It can trigger this. It can cause an overgrowth in this yeast. If you sweat easily, you are so fond of not allowing your clothes to get dried up properly, your clothes will still be damp and you will wear it, it can trigger fungal acne. So now, how do you know that you have a fungal acne? How do you know that this is fungal acne? They come in uniform. You know how your regular acne, you have maybe one large acne here, have one here, have one here, maybe have two. Fungal acne does not come like that. They come as a group. You might have maybe up to like 6 or 7 of them clustered in an area, and then with maybe pus in their mouth, but that thing is not pus. So you do not press it. Even if you try to press it, you won't even press any. There is nothing in there. That thing is just like an illusion. Okay, it is not really a pus per se. Now they come in clusters, mostly on your jaw areas, on your forehead as well. Now, if you are like me, who is acne prone on the body, I started noticing mine too on my chest region, then here and here, down here. I'll try and know if I can. Okay, see, I've treated it. So this is my upper arm. I've treated it, but I'm dealing with the hyperpigmentation right now. So this is what it looks like. I used to have like maybe just clusters of it. Maybe I'll have cluster here, have another cluster here. It is fungal acne. I will also show you guys a picture of my face when I had this fungal acne here, and sometime last year as well when I had it on my cheek area. I'm going to show you pictures, don't worry. So now, treating the one on my face, it took me 2 months. I'm not kidding. 2 months to treat it. But the ones on my hands took me 2 weeks max. Like I said earlier, if you want to avoid this, okay, if you do not want to trigger it, remember that it is a yeast that is already on your skin. It is naturally on your skin already. It is just, do not trigger it. Do not make it angry. Do not go and abuse your antibiotics. Don't go and wear damp clothes. Make sure that you wash your beddings more often. Make sure that you control oil, especially we that have oily skins already. We have to be very, very careful. When it comes to treatments, now you already have this acne, this fungal acne, and you have been using your regular salicylic acid, you've been using your lightweight moisturizers, you have been your tretinoins, you have been doing a lot to treat this, and you are noticing that it is even expanding. It is expanding. What I will tell you to do is get a cream that contains this ingredient, ketoconazole. I'll show you the one I'm currently using. This is my own. This is my ketoconazole cream. It's not even expensive. I got this for 715 naira from a pharmacy. So this is a ketoconazole cream. Very good for fungal infections. This is what is going to treat that fungal acne, not your salicylic acid, not your tretinoin. This is the outer packaging. This is the outer pack. So this is what is going to treat it, not your salicylic acid, not your tretinoin, not niacinamide. No, no. Go and get this, okay, and use it on that fungal acne. If you must take any oral medication, make sure that a doctor prescribed it. Don't go and take oral medication for fungal acne because you saw one skincare influencer saying it. Currently, I'm not using this anymore in my routine because I'm done treating what I want to treat, right? But if there should be any case of fungal acne again, of course, I'm going to introduce this again into my routine. But for now, I'm not using this. So now this is how it comes. It is a thick formula so that you'll be aware. It's a thick formula. See, you see, it's not lightweight at all. So what you need to do is, whatever place you have that fungal acne, all right, take this and just rub on that area. It is nothing serious. Rub on that area, allow it to seep into your skin. I usually give mine 5 minutes max to get absorbed. Then I rub my aloe vera gel on it for hydration. Now it must not be aloe vera gel, like I said earlier. It must not be aloe vera gel. Just make sure that whatever product you are using on that area is not taking consistency. No oils, no oils, please, no oils. Remember what I said earlier, that this yeast thrives very well in oily places. Okay, it thrives well in oil, so no oils at all. Whatever you are using on that area should be oil free. Okay, then for we that have oily skin types already, you might want to ask, okay, so what do I do? What do I do then? Now, I even feel like that is also one of the reasons the fungal acne on my face took time to treat. Remember what I said, that it took me 2 months to treat the one on my face, but the one on my hands took me just 2 weeks. Now, the reason it took me that 2 months was because I have an extremely oily skin on the face. My face produces a lot of oil. So now, in order to help curb that oil, you can introduce niacinamide in your routine. You can introduce zinc. You can introduce green tea. Just these ingredients that help control oil, you can introduce them. Now, what I do is that I use niacinamide at night, every single night in my routine. Of course, niacinamide is like a staple in my skincare routine. So I use my niacinamide, right? I use after my niacinamide, then I use this, and then use my aloe vera gel. Then the face wash I was using when I was using this, when I was having fungal acne, was tea tree foaming face wash. We know tea tree foaming face wash, it is actually drying. Now you are going to notice the dryness so much if you have a dry skin type already. But for me, who has an oily skin type, I noticed the dryness, but it was just mild because I have an oily skin type. Okay, so at that point, tea tree foaming face wash was just the perfect face wash, affordable, and was still doing the work for me, right? Then my niacinamide serum, this ketoconazole cream, and then the aloe vera. That was it for me every single night. So on nights, I will be using the salicylic acid, I won't be using the ketoconazole cream because I just felt that it's going to be an overload on my skin because all these things are actually actives, right? And this ketoconazole contains steroid. So, and considering that I also have other acne I was treating aside the fungal acne, I had comedonal acne I was also treating. I have an acne prone skin naturally. Okay. So what I now do is on days I will be using the salicylic acid. I don't use the ketoconazole cream. That was just it for me every single night. My face wash, my niacinamide serum, my salicylic acid or the ketoconazole cream, then aloe vera comes in. Aloe vera for that hydration, basically. You know that from the face wash already was stripping my skin. The salicylic acid is drying. This one as well, no hydration. So I need that hydration. Reason I incorporated aloe vera into my routine. So it must not be aloe vera for you. Okay. If you have any good um lightweight moisturizer that does not contain oils, you can use it. It must not be aloe vera. Okay. So that was just it for my skin. So fungal acne is, just note that it is not something that that responds to your regular acne treatments. Okay, so you have to know how to identify it so that you can treat it the right way. So please, if you have any questions to ask in the comment section, of course, go ahead and I'm going to give you a reply. Meanwhile, please subscribe, like, share the video. Okay, please join the community. Okay, join the community. Thank you so much and bye.